This is Nadine in 2001. This is me. We were new grads with high hopes when Nadine was diagnosed with multiple sclerosis. Her case was so aggressive that at first doctors thought she was suffering from a life-threatening brain infection. Nadine was confused, had difficulty recognizing faces, and didn't know what year it was. It was terrifying to watch, and I feared we might lose her. It took 9 months of chemotherapy to stabilize her. Nadine's MS was unique and her recovery so remarkable that she became the face of the Johns Hopkins MS Clinic under the care of Dr. Peter Calabrese. After being closely followed for her first couple of years, Nadine eventually learned to compensate and life returned somewhat to normal. Then in 2012, on the way to see Dr. Calabrese at Johns Hopkins for a routine follow-up, she fell in the airport and injured her knee. An MRI revealed new activity, confirming a relapse. She received steroid infusions, but within weeks her condition deteriorated to the point that she was rushed to the emergency room, admitted to the hospital, and then transferred to rehab and finally nursing care indefinitely. Her roommates were geriatric stroke and dementia patients. This was the new life she had to adjust to after living independently in her home just a few weeks previous. She was only 34. We were told repeatedly that this is MS and we should get used to it. Since Nadine was still actively relapsing, I knew there was still some hope. A search on clinicaltrials.gov led us to a phase 3 study by Dr. Richard Burt at Northwestern University. I stayed up all night filling out the initial paperwork for Nadine to be considered for Dr. Burt's study. Within days, I spoke to both of his nurses and was told that Nadine was a strong candidate. We were scheduled for an initial consult with Dr. Burt around Valentine's Day of 2013. During that visit, Dr. Burt put his hand on Nadine's knee and said, "We can help you." After 6 months of feeling like we were both lost in the medical care system, I finally felt a deep sense of relief. Dr. Burt has refined a procedure known as HSCT for the treatment of relapsing, remitting MS and other autoimmune disorders. The process is similar to that used in blood cancer treatment. Patients undergoing HSCT for MS receive a high dose of chemotherapy to wipe out most of their immune system, and then they receive their own bone marrow-derived stem cells back. Within weeks, we had made numerous trips back and forth from Massachusetts to Chicago as Nadine went through pre-testing. She received Neupogen injections to promote stem cell production. She had a Bas cath inserted into her neck so that she could have the stem cells isolated from her blood. During that process of pheresis, she was hooked up to a machine for a full day in order to isolate enough stem cells for a later transplant. At the beginning of May, she was admitted to Northwestern for the core treatment. She underwent almost a week of receiving IV fluids followed by 4 days of chemotherapy. On May 13, 2013, with Dr. Burt, her nurses, and the hospital chaplain there to bless her stem cells, she received a 30-minute transplant or infusion of her own stem cells. We then waited about 10 days for her stem cells to grow, for her counts to increase, and for her system to stabilize enough that she could be released. At the end of May, we left Northwestern and Nadine went straight to inpatient rehab, where she received about 4 hours of intensive one-on-one physical therapy every day. Her recovery was astonishing, as with each day she regained function, strength, and balance. After a year, she showed no signs of ever needing a wheelchair or assistive device. And on our 2-year follow-up on May 13, 2015, we were informed that her most recent MRI showed no new activity and in fact a decrease in lesion size. Nadine no longer requires her costly MS medications, which involved painful injections and harsh side effects. She is stable, and according to Dr. Burt's 10-year study data, nearly 90% of his MS patients like Nadine never relapse again. My only question is, why is it so hard for MS patients to find out about this potentially life-saving therapy? While it is technically still in a clinical trial, it is nearing the end and has shown remarkable results for patients. I found out about it because as a scientist, I'm comfortable searching clinicaltrials.gov, but surely this isn't how most patients should learn about it. Please help us spread the word. MS is a chronic, progressive disease often diagnosed when a person is still a young adult. It often leads to unemployment, lack of independence, and social isolation. But there is hope. Some people with MS might be strong candidates for HSCT. They just need to know that this therapy exists. Please help us get the word out by sharing our story. You can also check out these links for more information.